Hi, Dr. Pelto here. I had a patient ask, what is the cost of the speed bridge procedure for Haglund's deformity? In the past, a number of years ago, I did a video on Haglund's deformity. So I'm going to put a link to that if you want to watch all the details about the speed bridge. It's probably been about 10 years now since I did that video. But let me explain a little bit what the speed bridge is. So speed bridge is this little thing, this little bridge that go around and you suture things into the Achilles tendon through the Achilles, and you detach and reattach the Achilles, and you take off a big bump on the back of the heel. That's what the speed bridge is, okay? And the reason for this suture here is because you have to cut all the way through the Achilles and kind of split it. Let me explain. There's a big bump on the back. This is an example of a bursa, but this is the big Haglund's bump. You can see an example right here of the Haglund's bump as well. And what you do is you split through the Achilles. As you saw before, you split through it, you open this up, and you partially detach it on the sides. And when you do that, you're able to get access to this bump, shave the bump off here, shave the bumps. Here's an example of some other bumps right here. You shave those off, and then you reattach the Achilles tendon. Everyone asks, like, what is the price? I think the actual price, what as surgeons we might get, I don't know, $800 or $1,000 or something like that. It's not worth. It's hard because it's not really. It's not per procedure. It's like what insurance covers, Medicare, things like that. So 500 to 1,000. And then the actual device itself, there's a certain bill for that. And that might be up to $1,000 for the actual sutures. And that's Arthrex that makes that. And then the hospital gets a certain fee as well. This isn't something that's typically done in the office. So the hospital will get their fee for all their staff and everything. So when you add it all up, most people don't pay out of pocket for something like this. Usually insurance covers it, but it can be several $1,000s because of everyone involved. You have the surgeon, you have the anesthesiologist, you have the hospital staff, you have the actual material, and then everything else, and then the stay in the hospital, depending on how long you have to stay for that. So that's about the Haglund's. I try to avoid doing the Haglund's repair. Occasionally I have to do that, but there are some other options. This is my Haglund's deformity treatment evaluator. This is how I kind of evaluate it. I keep changing kind of how I do it. But certainly physical therapy to reduce the tightness, home therapy such as foam rolling, night splint, stretching. I don't find orthotics particularly helpful with Haglund's, except for the heel lift. Lifting up the heel can help a little bit. Appropriate shoes, open back sandals that don't irritate it. Once again, I also don't find orthotics all that beneficial for the Haglund's, but heel lifts and things like that can help. I find these days shockwave therapy can be very beneficial to helping to heal it, especially if there's some bone swelling. And I'll kind of explain that. So where the Achilles inserts into the back of the heel, right here, there can be a big bump, but there can also be swelling inside of the bone. There can be irritation. And I find that the shockwave, by re-injuring this area, it can help the tendon to heal. It can help the bone to heal and help it to feel better. It's not going to, I want to be clear, it's not going to take away the bump. The bump is not going to go away, but there are many patients that have bumps without pain. So the goal is to get it to be a pain-free bump. Okay. And then you also have to verify there's not a bursa or something else going on there. So an ultrasound can help with doing that. I do a lot of shockwave for this. This is an example of a shockwave. You would treat it a little bit further down. I find that Haglund's, it hurts a little bit because it's basically you're hitting this jackhammer thing on the back of the heel, and it's painful. So you have to tone it down a little bit. There is a focused and radial shockwave that can be used for it. I find that the focused, this is an example of the radial, but the other device, which is the focused, works a little bit better on the bone if the bone is involved, such as bone marrow edema or swelling. You would only notice that though with an MRI of that area. But those are the kind of the non-surgical options. I guess you could also put someone in a walking boot to rest it as well. That could be an option. Very rarely do we do cortisone, only if it's like just on the side of the Achilles. You might do a little bit in there, but you really want to avoid that to not cause a tendon rupture. Okay, so that's some information about Haglund's deformity. If you have any other questions, please let me know, and you can watch that other video that I did in the past on the Haglund's deformity. Okay, hope that's helpful. Thanks.